focused on infectious disease and public health. She is a physician scientist at Fred Hutchinson Cancer Center, where she continues to focus on HIV prevention through vaccine development, clinical trial design, and harm reduction. I will now pass it off to her to get us started. Thank you.
Excellent. Thank you so much, Jasmine, and thank you everyone at ARTH for inviting me here. And thank you everyone who signed up to listen to this talk, because it seems like we've been talking about COVID forever, and it has been a long time. 3 years is a long time. And we're going into, flu season, and along with flu season is COVID season. So let's have a chat, shall we? Let's begin. So what is long COVID? Long COVID is a post-COVID condition that has a wide range of health problems that come with it, right? It's usually something that happens 4 or more weeks to 2 months after your first
recording in progress
bout of COVID. And so these conditions, these symptoms, they present differently in different people. They present differently in different combinations, and they present differently for different amounts of time. So even people who didn't have lots of COVID symptoms, strong COVID symptoms during their initial infection, they can still have symptoms that are lingering from after they feel like they've recovered. So these post-COVID conditions are also known as long COVID. Sometimes you refer to it as long haulers, post-acute COVID. There's all different kinds of names. So experts, CDC, WHO, the president's, COVID relief group, their task force, we're all working to learn more about COVID, just so we can learn more about the virus. We can learn more about how it affects people living with the virus. Learn how it affects people post-COVID. And it also, we're starting to look at groups of people who tested positive for COVID but never had any symptoms, so we say asymptomatic, and people who have never had COVID at all, right? Never tested positive and never had any symptoms. So that's kind of the next wave of research that we're looking at right now. Let me see. I will try to do my best to monitor the chat. I might not do a great job of it, but please, Jasmine will ping me if anything is really important, and then I will stop.
I gotcha.
Thank you. Okay, let's see. So this is just a snapshot. This is from July, but it's still pretty, it pretty much covers what we're looking at right now. So this is the places where COVID-19 is at its highest. And it's the places where you think it would be, our typical red states. But Washington, we're kind of lucky. We're in the orange. And this is actually true. I checked this morning. There's about that many cases, 10 to 24 new cases per 100,000 people. So that's about correct. So this is the community. King County is right here, which is where we are. And so we've got high transmission rates. This is not great, but if you look on the top here, you'll be able to see the United States at a glance as far as trends are going. So this is current as of today. We have some cases that are going down, deaths are going down, total hospital admissions also are going down, but now we're starting to get back into flu season, RSV season, COVID season. And so we're seeing a small uptick up here on some of these, but we've got some help for that, and that is in the form of COVID booster, and we will talk about that later. So what is long COVID? These people have not fully recovered from COVID weeks or months after their first symptoms. Some long haulers experience continuous symptoms. Sometimes there are old or new symptoms that are also associated with long COVID. We like to call these a constellation of symptoms, like the constellations in the star. Sometimes they're there, sometimes they're not there. When they're there, they're shining brightly. And they come and go as they like. Other infections that have these sort of long-lasting symptoms, Lyme disease has something that's very similar to this. After you've recovered from Lyme, the virus still kind of lurks around in your body, and you might have symptoms that are a constellation like those we see in long COVID. Let's see. So what are these? They can be difficulty breathing, shortness of breath, tiredness, fatigue, symptoms that grow worse after you do physical activity, sometimes mental activities. We get post-exertional malaise or brain fog, so you have a hard time concentrating on things. You can have cough, so you can have symptoms that are very much the same as when you actually had COVID. Cough, chest pain, stomach pain, GI symptoms, headache, heart palpitation, joint aches, muscle aches. Sometimes people experience numbness and tingling that sometimes feels like pins and needles. We talk about that. GI, you can have insomnia or feel like you want to sleep longer. Sometimes you can have a fever, dizziness on standing. You could get a rash, mood changes, the change in your taste and your smell, and some women have experienced changes to their menstrual cycle. So this is what we've been seeing. This is current as of today from the CDC. Oh, just kidding, through July 4th. But I still got it from the CDC, so that's okay. These are symptoms of post-COVID symptoms from people after they have had their test. So you can see the colors here. So the blue line is their initial symptoms that they noticed. Green is 3 months later. Purple is 6 months. This teal color is 9 months, and the orange color is 12 months. And so these are symptoms reported from about 4,000 participants after they have gone through their COVID and are, living with. So we have any kind of cardiovascular symptom, any kind of constitutional symptom. So those are constitutional symptoms are things like body aches, muscle aches, fatigue, things like that. These are, GI symptoms here. Headache, fever, nose congestion, sore throat, all that stuff. This is the majority of what patients are really reporting after at least 1 year of having COVID. Any kind of musculoskeletal symptoms, so more joint aches, muscle aches, and pulmonary symptoms. So we've got these constitutional kind of overall kind of feeling of malaise and unwell paired with, residual and persistent regular COVID symptoms. That's what we've been seeing the most.
And what we have in the chat here, just real quick, Dr. Furch, I believe Christine put here, do we know what percentage of people infected with COVID develop long COVID?
We do not know. That's one of the more frustrating answers. I understand that. Because COVID can infect anyone and their symptoms might look like anything and they might last for any length of time. We only have the facts as far as it's going to be predictably unpredictable, which is not necessarily reassuring, but we have basic time points that we can kind of tag for the duration of COVID. Like we know how long it takes between being exposed and then showing symptoms. And then we know how long it takes, which is about 3 to 7 days. We know how long COVID generally lasts in people, in healthy adults, which is usually about 10 to 14 days. And then that recovery period really depends on the person. All the things that go into your life and your lifestyle. And we don't know how long that recovery period will take. We don't know what symptoms will remain. It's all kind of up in the air. And so we just continue to gather data so we can have those fun graphs like this one, so we can kind of report it and track it so that for the next season or the next variant, we can make some more educated guesses. So whom does long COVID affect? Like we just talked about, literally everyone. elderly and the adolescents. We have to think about kids in preschools, people in assisted facility centers, people with pre-existing conditions, diabetes, heart disease, if you have asthma, things like that. People who are immunocompromised. So we like to think about, we say pregnant people in this group, not because they're ill, but because their immune system is doing double duty. So it's mom and baby. So we say immunocompromised. But you also have to think about people who have had a transplant or who are undergoing chemotherapy, right? We also want to talk about the medically vulnerable. So this is people who might be experiencing homelessness, people who don't have regular access to healthcare, right? And of course, us, our African American, our Asian, our Latinx community, who historically have just not had the best experience with healthcare. And, it seems as though sometimes we're left behind. So we are at a higher risk and more susceptible to, getting COVID and then having those long-term effects kind of be elongated. So let's talk about that. Let's talk about the social determinants of health. So these are things that, even if you don't think about it, they affect every single part of your life, for good and for bad, right? Nutrition. Do you live in a food desert? Do you have access to grocery stores that aren't like a bodega, right? We want to have fresh fruits, fresh vegetables, all that stuff. Neighborhood. That's going to determine what you have access to. It's going to determine where your groundwater comes from. It's going to determine if they have recently done renovations in your neighborhood. Is there lead paint? Was there asbestos? Things like that. We talk about our physical environment. We are lucky enough to live in the Pacific Northwest where you're going to go outside and not burn up in the summertime, and you're not going to freeze to death in the wintertime. So that physical environment is something that's really important because we talk about air pollution, we talk about climate change, all that stuff. Healthcare. Do you have access to healthcare? Do you have a primary healthcare provider? If you don't, do you know where to go to reach one, to establish care? Do you use the Washington Health Department's, activities and centers? Do you have access to that information? Do you use your Bartell's pharmacy, right? Your pharmacist is also a healthcare provider. We have to think about your occupation and your job conditions. A lot of us are doing jobs where we're quite sedentary now. So you have to make sure that the chair you sit in is ergonomically correct. So you don't have a hunch or, you are able to stand up in the day. Do you have a mat where you can stand? Things like that. Are you doing construction work where it's a lot of repetitive movements? Over time, these things can affect your health. Income and wealth also affect your health. So is more money sometimes correlates with, better insurance. So you have access to better healthcare, quote unquote. So all of that kind of a thing is something that's important. And education. Your education it can determine sometimes your income and wealth. It can determine your neighborhood. It can determine what you know about health and healthcare and how to advocate for yourself. So always use your resources and try to make sure that you're up to date and advocating for yourself as best as you can. So let's do a small case study really quick. I read this article on NPR because I love it. And it's from Kenny Cooper, and he is a 35-year-old African-American male who lives in New York City, and he got his first case of mild COVID for him, over Christmas. So he had all the usual signs and symptoms: sinus pressure, sore throat, headache, extreme fatigue. After 8 days, he was feeling better, and he tested negative 2 days in a row using a rapid antigen at-home test. He got his vaccinations when he was able to, and he even got boosters. He was thinking, party time, I'm ready to mingle, and I'm single in New York, you know how they do. He goes to a Christmas party, and after one glass of wine, he felt like he drank the whole bottle the next day, completely exhausted, muscle aches, body aches, fatigue, but couldn't sleep. In the days and weeks that followed, he managed his insomnia, but still had this extreme fatigue, especially after doing activities that were usual for him, like taking a walk around the block, things like that. So he was like, what's going on? These waves of fatigue, it's not getting any better. So the more he started talking to his friends about this, the more they started to say, when I had COVID, the same thing happened to me too. But his symptoms weren't such that it was 4 months after his initial illness. It was more like, 8 days. That's not long at all. So he's kind of in this in between. So now I'd like to talk to you a little bit about medium COVID, because it's like long COVID, it's long COVID light. Let's say that. Because we're in this time now where we are living with COVID. You'll start hearing people say, it's endemic, which means it's just something that means it's with us all the time. The flu, it's endemic. It's something that, although there are rates of mortality and morbidity that are associated with the flu, it's not wiping us out like it did in 1917. So we're living with this now. So let's see, what is medium COVID? You'll get waves of fatigue still. You'll have some of those similar symptoms like original COVID, like smell and taste aren't there. It can leave people bedridden or unable to feel like they can recover fully. It's usually that in-between state that's still very significant viral illness. So we have to not discount medium COVID just because it hasn't gotten all the way to long COVID. So what we really want you to do is think about your body and really listen to your body. This is the biggest takeaway about COVID that I can say at all. Once you have had exposure to COVID and then you develop symptoms of COVID, listen to your body. Take the time that your body needs to recover. Even if you have to do that. Medium COVID, long COVID, it can happen to anyone. We have to make sure that we listen so that we can communicate effectively to our partners, to people in our family, to our employers, so that they can understand what you're going through and also understand that it's going to be different for everyone, especially who do we speak about before in that list of people whom long COVID affects? That's us, okay, at any age. So I also want to impress upon everyone that vaccines, they are not the silver bullet that they were touted to be, back when we were kind of rolling everything out. Vaccines are a way to protect yourself, to protect your community, right? So when you get vaccinated, it's to decrease the likelihood that you will be hospitalized. It's to decrease the duration of symptoms that you may feel, so that your recovery process can go a little bit smoother. We don't know yet if it's preventing medium and long COVID, but we know that if you are feeling prolonged effects of COVID, that they will be lessened and that you will be on the road to recovery, hopefully faster.
Dr. Furch, this may be a question for unemployment claims or FMLA directly, but do you happen to know, can people get FMLA, the family medical leave, because of long COVID symptoms?
You can, and so that's one of the things that you'll have to speak with your HR provider about. So because everybody's symptoms are different, and because you're not technically spreading virus anymore, it's a conversation that you have with your HR representative, because you may need to take more time to be at home. You may want to continue to work from home for an extended period of time. And it's something that shouldn't be a hurdle to getting those benefits because, health is a human right. And so that's a conversation that, I know for me at Fred Hutch, we're able to have that conversation with our HR representatives. So I can't speak for all companies, but you should be able to do that. That's what I recommend.
Thank you.
You're very welcome. Okay, let's see. So what's going around now, the most notorious variant of them all is BA.5, right? We had Omicron, we had the Wuhan strain, we had Alpha that was big here, Beta was in India, we had Delta, we had a Gamma that was big in the Middle East, we had Omicron, right? We had BA.2, and then we had BA.4. Well, we had all the other ones, but our biggest ones here were 4, 4A, and now we're on 5. So is it more dangerous? There's no evidence that says that it is. Infectious disease experts say that the new infections are on the rise and they're most likely to be BA.5. That's what's in circulation at the moment right now, when we saw that picture of King County up there. But it's better to be more equipped. Each country is doing what they can do in order to equip themselves with BA.5. And in order to do that, I haven't done anything, but they've manufactured and developed a BA.5 specific booster. So you can go online, and I did this today actually. You can go to the CDC's website and you can ask it, am I eligible for my booster, my Omicron booster? And it'll take you to a screen and you just like point, click, and it says, how old are you? Where do you live? Are you immunocompromised? Male or female? All these like small things. And then it'll say, oh, when did you have a full series of the initial COVID vaccine? Were you boosted before? And then yes or no. And then it'll say, yes, you are eligible. It is time for you to get your Omicron specific booster shot, or no, you can wait, things like that. So I encourage everyone to go online if you are unsure, but I encourage everyone to sign up for your Omicron specific boost if it's been more than 6 months since you had your last booster shot, or if it's been more than 3 months since you've had COVID altogether, right? Let's arm ourselves. Let's get the facts together and arm ourselves for this season of COVID, because I'm telling you, it's coming.
And I believe I found that quiz on the CDC website. It's going to be half down at the bottom of or middle half of the page. And it goes through those questions, just as Dr. Furch mentioned. So I put that in the chat. And then we have a question from Christine. She said, is BA.5 considered to be more transmissible than previous variants?
Not necessarily. It's just the one that is more prevalent in the community. So more of the infections that you see will be BA.5. And variants happen when someone is exposed to, let's say I had, Gamma. I had Delta. So I had Delta, and then someone from someplace else had a variant of Omicron, right? Then it mixed together, how the body does what it likes to do with its T cells and B cells and your natural immunity and all of that. And then it's spat out, this variant, right? And then someone else got it, and then it changed in its body, et cetera, et cetera. So variants, unless a drastic thing happens, and this is the way of virus biology and the natural progression of certain viruses, unless something drastic happens, just going to be the variant that is prevalent in the community, and we do not think it is more contagious. We do not think it is more severe. So we just encourage, doing those things that we should be doing anyway: washing hands, keeping a distance, masking if you feel comfortable, all of that stuff. And we'll talk about that later too, and getting a boost.
And I have just one more question. What are your thoughts about mixing vaccines, specifically Pfizer and Moderna?
That's okay. If you can only get Pfizer, if you can only get Moderna, and it's different than your previous vaccine, take it. I mean, they work very similarly. It's going to still kind of have that fake spike circulating around in your body so that it can respond to it and then make antibodies. But yeah, there's no right or wrong vaccination to get. Some studies say it's better to mix and match. Some say it's better to stay with the same, but each study agrees, as long as you're getting something, we're good to go, right? Protect yourself, protect your community. That's the biggest message that I can give you guys today.
And what about folks who are mixing Johnson & Johnson with Moderna and Pfizer?
Same thing.
Okay.
Either way, yeah. When it's time to get your boost and Johnson & Johnson doesn't have, it's only Pfizer available for you, take that Pfizer and do it. And it's just one shot because it's just a boost, right? We do a series, so it's called a prime and then a boost, and then you get another boost. But that second boost is like, the first boost after the prime is the second dose in the series. So that's your prime series, and then you get boosts after that. So now it's flu season, so we get boosts for flu, and we can get your boost for COVID as well.
Thank you.
Of course. So COVID management, if you're feeling like you are having, you've recovered mostly from COVID, but you still feel like there's some lingering there, you're in that medium, long COVID kind of transition zone, listen to your body. That's the biggest thing that we can say. It's to manage and optimize your quality of life at the end of the day, right? So speak with your healthcare provider and develop a comprehensive management plan that works and focuses on your symptoms, right? Your mental health needs, your social situations, and talk about your treatment goals, right? Like we talked about before, everybody's body is different. So they're going to respond differently and have symptoms that are different. So just have communication and advocate for yourself with your healthcare provider. They can get you in touch with physical and occupational therapy. If you might need speech and language therapy, vocational therapy, get someone in your office, in your workplace, to fix that chair, to get you a standing mat, to get you a physio ball instead of a chair, things like that. They have neurologic rehabilitation PT programs, right? If you're feeling numbness and tingling, they might be able to direct you to a rehab place where they can help you with stretches so you're not feeling, it can alleviate some of those feelings that you're getting with your COVID symptoms. So it's most important to listen to your body and to communicate with your healthcare provider throughout this whole thing. This isn't the time to be walking off that sprained ankle. Like everyone was like, oh, just put some dirt on it and, Windex or whatever. No, take a beat, relax, listen to your body, and move accordingly. This is just reiterating that whole thing. It's totally holistic. It's a conversation, and advocate for yourself. I want to especially talk about Black women because we are the caregivers. We are always looking out for everyone else, but the things that we have to always remember and advocate for ourselves when we speak with our healthcare providers, we want equanimity, right? Reciprocity, respect, and recognition for the whole person, because it's not just this or that, it's all of you. We want to be bodily empowered. If you have, a secondary symptom or comorbidity, diabetes, obesity, smoking, whatever the case may be. Body empowerment. This is my body and this is how I'm feeling, okay? We need freedom from fear and shame. You shouldn't feel ashamed. Again, it's your body. And there are stigmas that come with being an African-American woman in America. That's just how it goes. We're Black in America. But don't feel ashamed when it comes to your healthcare. You must advocate for yourself, and you should go to providers that respect that and can advocate right back with you, because it's a conversation and it's your health. And I can't say this more than I do. Like, health is a human right and everyone deserves it and everyone deserves respect. So those are some of my key points about COVID. Listen to your body, advocate for yourself, recognize your, oh my gosh, I'm losing my words. It's been a day, you guys, it's been a day. Recognize all of the other aspects of the healthcare that go into healthcare. Get vaccinated, get boosted. Let's see. Maintain your regular checkups with your regular healthcare provider. Follow the current guidelines. If you have questions, ask. Arm yourselves, protect yourself, and protect your community. Yep, some more interesting things to talk about. The guidance that's out currently, it acknowledges that the pandemic is not over. It's saying that we just need to focus on keeping ourselves and our community safe. It says Ellen Irving Furch has raised her hand.
Yes.
What's happening?
Dr. Furch, can we go back to the vaccination question segment again for just a second? If you've not had the second booster, can you still get the fifth boost?
The Omicron, the BA.5 variant?
Or do you have to get the fourth one and then get the fifth one?
No, you can just get the Omicron boost currently. If you go in, the answer to your question is yes. Just go ahead and get that boost. It doesn't matter which one it is, but the ones that are available to us are the BA.5 variant. They're specifically engineered for that one, so that's what they have available, and it will not hurt you if you haven't had the previous ones. So go ahead and you can go make an appointment with your healthcare provider. You can go to supermarket pharmacy, regular pharmacy, and set that up and sometimes you can even get them at work as long as they're available. So yeah, go and get that. It doesn't matter if you haven't had the previous series.
Thank you.
Of course. All right. Now, I know that I'm talking for 1,000 years, but we have another, it's not a pandemic, it's not even an epidemic. We're having an outbreak right now, which is monkeypox, which is on everybody's mind. So I just wanted to say a few words about monkeypox, okay? Really quickly. This is kind of a graph that's showing you, this was our first case, confirmed case in May of this year, so over the summer, and they've just kind of grown and grown and grown and grown and grown. This is up until August 24th, but it's still, it's kind of, the line's looking like this still. We haven't quite plateaued yet. So far, in the US, we've had about 22,000 cases. And you can see where Washington is. Washington has had 520 confirmed cases, which is, in the grand scheme, it's not bad, but in the grand scheme, with all the other states, we could do better. So what is monkeypox? MPV, you might see it sometimes. MPX, you might see. It's a virus that's very similar to smallpox, but the symptoms are way less severe. Because if you remember from way back in the day, like they had the blankets with the smallpox on it and it killed everybody. This is not going to do that. It might look similar, but it does not leave the scars of smallpox, and it's just way, way less severe. It was first discovered in 1958, and there were outbreaks that occurred in monkeys that were kept in research. So what we're seeing in the United States is clade 2, which is from Central and West Africa. And in recent weeks, it's been spreading among people who tend to have sex with men. So, if you're getting these rashes and then you're, getting on your bed sheets and you're rubbing up against your boyfriend and, then you're going to get monkeypox. So let's look at a little timetable. We see that it's first discovered here. This is clade 2. So what we're seeing in America is clade 2A. It was first discovered in isolation in Singapore to Denmark in monkeys that were shipped. And then we started to see some cases here in the early 2000s in prairie dogs, and they were having them in the pads of their paws, which is a place where viruses like to stay and bacteria. Don't get prairie dogs. You don't need them. They're for the prairie. It's going to look like we've had human transmission throughout. This is a virus that people live with and recover from all the time. This is the first time we've seen a huge kind of outbreak in the States. Okay, let's see. So what are the symptoms? Well, you can get sick with fever, headache, backache, muscle ache, swollen lymph nodes, all that stuff, exhaustion. This is what we call classic B symptoms because it affects your B cells, which is one of your antibodies, and those are the cells that come and help you out whenever you have the flu or a cold. These are standard viral symptoms. So a few days after you feel this kind of fever and headache, you may or you may not get this rash, this stereotypical pox rash, that are flat red marks that become raised and filled with pus. And it looks not great. I'm not going to lie to you. It does not look great, but you'll know it exactly when you see it. On average, the rash will appear within 6 to 13 days, but it can take up to 3 weeks. And again, not everyone's going to present with a rash. So we have our exposure to the virus, the incubation period, which is about 3 to 17 days. Then you start getting your symptoms, and this is the prodromal period, right? So you might hear that sometimes, prodrome, incubation, all of that. So these are the prodrome, that fever, the lymph nodes, the fatigue, all of that. You'll see that about a week before you see your rash, and your rash can develop anywhere from 2 to 4 weeks, and that is the time when you're able to shed virus. You are able to transmit monkeypox virus. So what does this rash look like? Well, and how long does it take? You can start with a macule, 1 to 2 days. Then it becomes a papule, right? It's like a whitehead a bit, right? Then you get a vesicle. So you can start to see where it's starting to kind of pinch in on itself a bit. We call that invagination. Then you get a pustule, right? So this is like, oh no, it looks like I have an ingrown hair and I just want to pop it. Do not pop that. Go to your healthcare provider. They're going to take a scraping and then they can send that for test. And then after about 2 weeks, it'll scab over, and at this scab over time, you're no longer able to shed virus. What does it look like in brown skin folks? So the macule, it's flat. You have a papule, slightly raised. The vesicle, you can start to see it filling up and kind of pinching in on itself. The pustule, filling with the pus, and then the crusts, right? So how does it spread? It spreads person to person with close contact, touching, clothing, bed linens, respiratory droplets, right? So that means those small drops, just like how viruses spread, that's how you get COVID, right? If you are coughing, sneezing, making out with someone who has not only symptoms, but also rash, they can spread monkeypox. So it can be also transmitted from mother to child via the placenta or through close contact after birth. So if you are pregnant and you have been exposed to monkeypox, your OB will most likely recommend getting a C-section, just so we can eliminate that kind of mother to child risk once the baby is first born. So you think you might have monkeypox. What do you do? Well, if you just have the symptoms that are flu-like, we can't really test for that. So if you start to notice the rash, that's the thing that we're able to take a sample of, send it to the lab, and confirm or not confirm your case of monkeypox. But even if you don't feel the rash and you just have flu-like symptoms, and you feel like, I could have been exposed, I'm not sure, isolate yourself. Stay at home. If you develop symptoms, then, and the rash as that symptom, then you go to see your healthcare provider. Wear a mask so that you can protect yourself and others from transmitting those respiratory droplets. And then only really come out if you have to. And if you do, then wear that mask. So what's the treat? Go ahead.
Furch. Janelle shared a comment. So she said, so really it is close contact. Some folks are considering this a sexually transmitted disease. However, close contact is also how it spreads.
Correct. It's not a sexually transmitted disease. I cannot stress that enough. It so happens that people are getting it because it's mislabeled as an STI because men who are having sex with men that's the population that is, seeing the brunt of this illness. And, that's a lot of close contact and sex, obviously. So that's why it's kind of been lumped into that, but it's actually not. It's just close contact, a spread from respiratory droplet or droplet from the rash itself. And that's that, right? Sometimes you might have sex and you might get it, but it did not come from, semen or vaginal fluids. So what's the treatment? If you get sick, you can treat it symptomatically.
Ellen, raise your hand.
Yep. Go ahead, Ellen.
Most of the time when I've seen them talk about monkeypox on TV, they basically shown people's hands. Mm-hmm. Does it present itself on other areas of the body?
It 100% does. It can present itself anywhere where there's skin. So you can have it on your face, hands, arms, trunk, legs, genital area, armpit, all of the above. And so that's why if you start to feel those symptoms, then in the next few days, we really want you to kind of take a look over your body and see if a rash has developed. Hands is just something that's simple to photograph. And so we have a lot of stock photos of hands and arms and things like that. That was a good question. So what's the treatment? For your symptoms, you can treat those symptomatically. You have a fever, you can take Tylenol or Motrin. If you have headaches, same thing. But for the virus itself, we have two treatments that you can do. We have tablets, oral medication, which is tecovirimat. We call that TPOXX for short. It's for smallpox that we have a different emergency kind of use for it. And it's for our very, very severe cases. Otherwise, you can use the Jynneos vaccine, which is the one that they have been giving to everybody. If you are in a high-risk group, you're encouraged to get this as pre-exposure prophylaxis. So this vaccine was also derived from orthopox, which is the genus of virus, so the same family as smallpox. And it helps to reduce the symptoms. And you can take this is what's so great about it, is you can take this up to 14 days after you have had exposure, right? So preferably up to 4, but up to 14 days. So what does the CDC say about people who should have vaccine, right? Should get this pre-exposure prophylaxis. Well, people who have close contacts with people who have monkeypox. If you know that you've had a sex partner in the last 2 weeks that's been diagnosed with monkeypox. If you've had multiple sex partners in the past 14 days in a place where there's lots of monkeypox. So if you're on vacation and you guys were both there that's that situation. Or if you work someplace where it could be a health hazard, right? You work in public health, you're seeing patients with known monkeypox, or if you're working in a lab and that lab handles animals or the virus itself. So again, this is the vaccine. It is made with a live, non-replicating smallpox virus. And so that means that it will not give you monkeypox. Everyone gets nervous when they hear live. It's like, oh no. But they needed it to be live so that they could capture some of the DNA of the virus, but it's not going to replicate in your body. It will not give you monkeypox. So what they do is they'll give you 2 injections 4 weeks apart. And sometimes you'll get that post injection kind of feeling, achiness in your arm, tired, swollen lymph nodes, things like that, headache. That's normal. That's okay. If your fever gets really, really high, then you should go back and see your healthcare provider. But the vaccine is really great because you can take it up to 14 days after exposure, and it just reduces your symptoms, which is really, really awesome. So decreased headache, decreased muscle pain, all that good stuff. And you're protecting yourself and you're also protecting the community. So viruses are very similar like that. Vaccines are not silver bullets, but they are another means of protection, right? Washing your hands, keeping a distance, washing down frequently used devices like your phone, the remote control, doorknobs, all that stuff, your car keys. All these things play a role in your health. So other prevention strategies, get this vaccine.
Question, Dr. Furch.
Of course.
We just had a question. So as monkeypox continues to spread, is it going to be likely that the vaccine is going to be more of like a routine vaccine that everyone is going to need to get because it can be transmitted so easily through clothing and through touch?
Well, we're actually seeing a plateau in spread. So it's going like this, but it's like because people they have been vaccinated, right? And now we've learned so many things from our less than great COVID vaccine rollout and information that, we're taking all of those public health strategies and we're giving them straight to the people, right? If like symptom recognition, we have, prevention strategies, all of these things. So I don't think that it's going to be a requirement that everyone will have to get monkeypox vaccination. It's really for those people who are in the high risk group. It's the men who have sex with men. It's people who work in that environment. It's people who, are immunocompromised, things like that. That's the group that we're really looking to protect right now, because through that primary level of prevention, it will protect the rest of the community. So I don't anticipate everyone needing to get, and not just me, we don't anticipate everyone needing to get this vaccine, but it's that high risk group that we're really, really trying to encourage them to do this in order to protect the rest of us. Again, this is science and we work with people. And people do all kinds of crazy things. So, this guidance might change, next week, next month. But for right now, this is what we're going through and what we're working with. So what can you do to help prevent, yourself from coming in contact? Well, reduce, like we talked about before, wash your hands, keep a distance. Don't be afraid to ask about your sexual partner's, health care. What does your health profile look like right now, dude? If you're getting ready to go down, not go down, sorry, get down with somebody. Oh my goodness. I told you guys it's been a day. If you're getting ready to, meet up and hook up with someone, it's always fair and it's always safe to ask, when was your last test? Have you been feeling ill lately? Things like that. Have you traveled anywhere? Because we want you to have a great experience whilst you're doing that, but we also want you to be safe and feel safe enough to advocate for yourself. Okay. So that's basically the long and the short of monkeypox. And to the previous question, is this an STI? Some people say yes, and they kind of loop it in with it, but it's definitely not an STI. Sometimes because of this mother-to-child transmission, but it's not something that is an STI that like herpes is something like that. Syphilis is something like you talk about mother-to-child transmission, chlamydia and gonorrhea, things like that. Those are all STIs, and those also have mother-to-child transmission, but the route of transmission is different. With monkeypox, it will be that close contact after. It would be the immediate exposure to the rash from the baby to the baby from the mother. That's how this is how this is transmitted. It just so happens that the most prominent way for transmission is after sexual contact, but this is not an STI. I cannot stress that enough. So what are some other myths? It's not new. The vaccine is not new. The vaccine is live, but it will not give you monkeypox. It's not more deadly or more contagious than COVID. It was not created in a lab. The vaccine is safe. Chickenpox will not protect you from monkeypox. Monkeypox is not an STI. And it's okay, you can get vaccinated even after you've been exposed to monkeypox.
And Dr. Furch, when thinking about how a mother can transmit monkeypox to an unborn child, how does that affect the unborn child?
Well, children, we always are really careful with children, the elderly, and those who are immunocompromised, because their immune system hasn't for children, their immune system hasn't formed all the way yet, right? So we get really nervous that they will have an extreme case of the disease, right? So all those symptoms, they could have an increasingly high fever, which could lead to seizure, which could lead to an unfortunate outcome. So we don't want those things to happen. So we just take that extra precaution, and we would encourage, C-section. We would encourage, you can look at your baby, but don't touch on the baby and love on it as much as you want to until you're feeling better and you're all in the clear again. That's a good question. So what are the things that you've done now that you've listened to this presentation and me talking endlessly about things that you'll probably have nightmares about? Well, you've legitimized the facts, right? Now you're armed with facts about vaccinations for monkeypox, facts about vaccination for COVID, what long COVID and medium COVID look like, how to advocate for yourself. And you also know things that aren't directly an obvious link to healthcare, these social determinants of health, right? You know how to talk about an outbreak versus a pandemic versus something that's endemic, right? You know what is and what is not an STI. You can continue to do all the things that you're doing, like arming yourselves with facts, practicing good self-hygiene, encouraging others to get vaccinated, encouraging others to practice good self-hygiene. And because of all of this, we can continue to have 0 deaths that are attributed to monkeypox. It's uncomfortable, but it's not deadly. And we can decrease the amount of transmission that is going on in the community here or in all of your communities, rather, for COVID, right? By doing these simple things. So please keep learning, keep arming yourself. Here's some helpful sites. CDC, definitely, the Washington State Department of Health. Hank has this really great lay language infographics and just information about what's going on in the country. But the Washington State Department of Health is really great for local things as well. Those are really, really great sites that I even use. So just thank you for sitting through this, and thank you to all of the people that have put this together. Duke contributed some slides, UW contributed some slides, and Seattle Public Health also contributed some slides. So thank you everyone for listening, and if you have any more questions, I am available to you.
Oh, hi there. I do have a question. So, and this relates more to messaging around masking. So I have to say, I've been very vigilant. I always wear my KN95. I'm fully boosted, but it seems like somewhere along the line, people seem to think we've gotten the all clear as far as not having to wear a mask. I mean, I went to the Paramount the other night, and like nobody was wearing a mask. I was in a congested area at Lumen Field. No one's wearing a mask. I'm on the light rail. No one's wearing a mask. Well, anyway, you get the idea. So I'm fortunate enough not to have ever tested positive for COVID after a ton of PCR tests, and I want to keep it that way.
Yes.
So, so I guess the thing is that maybe the bottom line is I just have to know that I need to protect myself and
Yes.
be very vigilant about continuing to wear my KN95 because, your presentation actually on long COVID is like, that's sort of, sets the standard for me is not, I don't want to have to, and it's very unfortunate that so many people have before the vaccines and so forth. But anyway, so there you have it. So I don't know. It seems like the messaging is so, I'm confused. I feel like, why are people not wearing masks anymore? Excuse me.
I agree. And that's a really good question and a really astute observation. Mask fatigue is a real thing. A lot of people are like, I've had it. It's hot. I can't breathe. I'm on the subway now. So it really comes down to your own personal level of comfort. We've reached a point vaccination-wise and transmission-wise where we can only encourage vaccination as much and to just kind of recognize the symptoms and just also to remind people that this pandemic's not over, right? So although we're seeing less hospitalizations secondary to many, many people getting vaccinated, which is great, another way to protect yourself aside from vaccination is exactly like you said, your self-hygiene routine, washing your hands, trying to keep your distance, wearing your mask. Wearing a mask, I mean, I still wear one in public. I don't like to play those games either. I've never had COVID and I would like to keep it that way as well. But the biggest thing is however you feel comfortable. So because of all the other things that the community has grasped and taken up, you don't have to, but it's definitely your level of comfort. So.
Right. And, the thing is that I'm so conditioned to wearing a mask. I don't want to go into QFC without a mask. I mean, It's been protecting me all this time. I haven't had a cold in 2 years. I've been really healthy,
Hello?
So.
You probably won't even get the flu.
Right. Exactly. So anyway, I just wanted to bring that up because it's like, it's not gone, people. It's still out there, so
It's
just
still there.
I'm trying to protect myself. So.
Absolutely, absolutely.
Thank you very much. And it's just a wonderful presentation. And thank you so much for your time and all of the information you shared.
Of course, I know it was a lot of information.
Oh, no, it was very helpful. Thank you.
We have in the chat from Rena. She said, thank you for sharing this information with us. I appreciate your style of presenting. And then also from E. Robinson, she said this was very informative.
Thank you guys for listening. Thank you for taking the time out of your day. This was a lot of information to take in a very short time. We're learning, every day I come in and there's something new that, that we're learning from data that we're getting. And so, it changes, but we try to keep as up to date as we can so that we can keep our patients and our communities up to date as we can. So thank you guys very much. And thanks to Arth again for putting this together, and Louis Shackelford, I don't know if he's on still, but for taking this request, and I'm happy to do it.
Thank you.
Thank you for joining.
And then if there are, were you going to say something, Ellen? I'm sorry.
No, I was just saying thank you. It was very informative.
Oh, great. Okay, I want to leave it open for any questions.
Yep. That's my mom, guys. Yep.
Oh, awesome. Hey, Mama.
She's
Hi.
number one supporter right there. And,
I was trying to be incognito.
Yeah, I think the name gave it away, Irving Furch. There's a proud mama right there.
Love it. Thanks, Mom.
And I just wanted to say thank you for kind of clarifying that although it's prevalent among men that have sex with men, it's not a sexually transmitted disease. So people still need to be aware of the close contact and really be looking at people for those signs that they may be infected.
Correct. And again, it's like after you feel the symptoms, if you feel like or think you may have been exposed, get those symptoms together, be on the lookout for that rash. And then even if you don't have rash, but you go and get that vaccine. Because I know that at King County Public Health, all of our locations in King County, we do have the Jynneos vaccination. So you can go in and you can get your series scheduled and you can get vaccinated for this if you feel like you're at risk. And I encourage you to do so.
Great job, Brianna.
Thank you.
I don't know, but I'm logged in under Nadia's name instead of mine. But
Oh, it's Louis. Yes. Thank you, Louis, for setting this up.
No problem. My pleasure. Thank you for the folks at ARC for holding these wonderful events. Appreciate it and love to support.
Thank you, Louis. Awesome. Any other questions before we wrap up?
So I just would like to put out there, Jasmine has put it in the chat, but those who are seeking their booster shots, as well as pediatrics and all of those, we're giving it again October 8th at New Beginnings Christian Fellowship from 9 to 1. It's a walk-in clinic, and all we require is that, you just come in and you register when you get there. And it's all the COVID-19 boosters. However, we had the Pfizer this past Saturday. I got mine, y'all. But we had the Pfizer this past Saturday, but we're doing pediatrics. And with school beginning to start for all the aunties and the grandmamas and the mamas and the daddies, encourage their little ones to get vaccinated, okay? And thank you. It was a wonderful, wonderful presentation. Thank you.
Awesome. Thank you, Rena. And just so everyone knows, you will get the presentation slides emailed to you. There will also be a post-event survey that will also be emailed included with the presentation. So please complete that post-survey for us. And then aside from that, if there are any other questions, I just want to say thank you all for sharing this space with us. And check out our website, www.aarth.org, for all of our upcoming events. Thank you.
Thank you so much.
Thanks, everybody.
Well.
Yes. Bye-bye. Take care. Stay healthy.